Hello folks, I'm Caleb Schwarzendruber. I'm a sports therapist, which means I'm a licensed massage therapist, but I specialize in injury rehab and basically just getting people out of pain, getting them back to functionality. So we use a combination of active isolated stretching, deep tissue, exercise, all that kind of stuff. So oftentimes I hear my clients say after a session, getting them out of pain, how do I stay out of pain? How can I get out of pain on my own? And I love to hear that, because ultimately it's you as the client, it's you as a person that's going through pain. You have to get yourself out of pain. You know, people like me are only, helping you along your path. So I always like to just start with that. Don't ever rely on a physical therapist, a sports therapist, any doctor. You want to get yourself out of pain. Use these people wisely, but it's up to you. So I want to show you a couple of just quick, easy ways to get yourself. My whole life, I've kind of dealt with some recurring back pain. So I'm just going to show you a couple ways. I'm going to call this Method 1. I'm going to try to keep coming out with other videos to just show you different ways to come at back pain, but this is just kind of a quick and easy way to at least get out of stiffness. So I always start with a classic pelvic bridge. And I always try to match it with my breath. So, actually the best way to start off, I think, any exercise is just some 20 to 25 just big deep breaths into the stomach. Just start learning how to breathe in the stomach again. So on the inhale, you're going to try to tilt your pelvis anteriorly. So you want to inhale through the stomach, push your stomach up, lift, get that curve in the back as far as you can breathe in, and exhale, pulling the stomach down and going into a posterior tilt of the pelvis. And when you're doing this, you're pulling the stomach down to the floor, and you're going to engage the glutes slightly. And you want to do this, I'd say 20 to 25 times before, if you're dealing with any back pain, every day. So 25 of those, okay? Now let's progress into the bridge. So And so, again, let's say 20 to 25, 1 to 2 sets. Just do them, okay? So then from bridges, after activating the glutes, again, depending on how much time you have, right into the psoas stretch. So we've activated the agonist in this case. Now we're going to stretch the antagonist. And I like to do just a couple second hold. And what I'm focusing on the psoas stretch is activating the glute on the side of the stretch. And activate here and just give yourself a gentle push here. Really just trying to feel it in the inside of your hip there. And you can alter where your foot goes. If you bring the leg out a little bit, you're going to start to feel it a little bit more in your iliacus. But these are two very important muscles to stretch. And oftentimes activating the glutes, I think 50 of the bridges, 50 big deep breaths. Do a couple minutes of these stretches. I always find at least some relief. Oftentimes I get up with zero back pain. So I think this just needs to be repeated. So we'll call this step 1 today, method 1. All right? Good luck, folks. Just takes repetition.